Thank you very much. I'm Dr. Ilyes Baghli. I'm a doctor in medicine from Algiers in Algeria. Um, I learn more about nutritional therapy, orthomolecular therapy, and I create in Algeria first the Algerian Society for Nutrition and for Orthomolecular Medicine. I received around 11 years different scientists from different parts of the world, like Dr. Thomas Levy from USA, Dr. Nina Mikirova, also from Riordan Clinic in Wichita, Kansas. I received Atsuo Yanagisawa from Japan, also Dr. Gerd Schwitzmaker from Netherlands, George Birkmeyer from Austria, and also Dr. Therese von Schwanzenberg. Also, we received Dr. Gilbert Henri Crussol from Spain, and other professor, example Henri Joyeux from France, and other. And next 11 years, I was introduced and invited to be the next president of International Society of Orthomolecular Medicine. It was in Sao Paulo in Brazil, the 1st June 2023. And officially, the ISOM, International Society for Orthomolecular Medicine, is in Toronto in Canada. And I was the new president, and I was happy to do a new, story for the medicine and how to introduce an integrative therapeutic approach with holistic view, personalized medicine, and also global and multidimensional way, because no one can have the true answer. For every person, there is one medicine, and this is what I am doing for. So for that, we open a new way for changing the mind, going from there is a lot of semantic change I proposed. Example, we have not to say alternative medicine because it's like, against someone. So we have to use, example, integrative medicine. No megadoses of vitamin C or vitamin D. No, personalized therapeutic doses. So because someone can need more than other one, and there is no megadoses in therapy. And also, we invite orthomolecular medicine to be more open to nutritional therapy, of course, because orthomolecular medicine, it's like micronutrition, and also to open to neuroemotional accompaniment, neuroexistential accompaniment, and how to change all transgenerational trauma to cultural legs. And for that, I create a new approach, and I introduce it in different parts of the world, like in Algeria, in Tunisia, also in Morocco, in France, Belgium, Switzerland, and I am looking now how to do it and to share it more around the world. And I do a lot of conference in different university in Algeria and also in medicine and pharmacy faculty. And Algeria government is really open to integrative medicine. For that, he invited me to introduce, and it's like scoop, breaking news, to introduce the integrative therapeutic approach with the different way, orthomolecular medicine, nutritional therapy, neuroemotional accompaniment, and neuroexistential accompaniment as training in the summer university with official partnership with the university. So it's a little step maybe for to sharing this knowledge, but it's a big step for the humanity. And also we share in September 19, 2024, a hybrid orthomolecular protocol for cancer on orthomolecular journal. And it's amazing how it's be shared about maybe in 100 years, 100 days, around 18 million sharing. And it's amazing. And we give from different way to treat cancer. We make choice for 7 ways. First of all, orthomolecular therapy, about how to use vitamin C, vitamin D, and also zinc as with those doses for personalized therapeutic doses. And also we share about how to use ivermectin, fenbendazole, mebendazole, and also DON as treatment, as antiparasitic treatment, but not only as that, because how it make stop the parasite, it make by the same way stop cancer cell. We share also about fasting and about like physical activity, like between 14 to 70 minutes a day, about ketogenic diet, about hyperbaric therapy, about also different other therapy. And now we are looking to share different cases on oncologist magazine or journal, and we received an positive answer to share in 1 week or 2 weeks about the 3 cases that share about it. Mel Gibson, when he shared about our co-author, Dr. William Mattis, share about the patient. And also we are looking to share different cases from Philippines in Manila, and also from Riordan Clinic in Wichita in Kansas, and it will be in the future around November. So also I am invited to share this protocol in Japan in September, in Tokyo, September 14. Also in USA, in Wichita, Kansas, in Riordan Clinic, from 4 to 5 November 2025. So it's a really open mind. And also I share it with Nabreja University in Spain, dociencia.com. It's a master of metabolic cancerology. And we share all about this protocol, but not only this protocol, also about how to use vitamin D, how to use vitamin C, also about anti-inflammatory, nutritional program that I share, and it's amazing. It was published in Algerian nutritional journal the same day, September 11, 2024. And this is really important to be healthy. And also we share about stem cell, mitochondrial targeting, and cancer cell. Also, that was in April 17, 2024 on MDPE journal. Uh, Really, time before, I share about how to combine vitamin C and NADH and how it promotes to make a cancer cell as normal cell. And not only the Koreans share about it now, we share about it in 2016, and it was published in David Publisher Journal. It's in USA, I think. And I received different awards like award for therapeutic innovation for different lifetime achievement in NIMS University in Jaipur in Rajasthan in India in February 2016. And I received also a Hall of Fame Linus Pauling Orthomolecular Medicine in the end of April 2018 in Tokyo, in Japan. And we hope that we can do more, because you have to know that Dr. Paul Marik, who is also co-author of Hybrid Orthomolecular Medicine, is in the team of Kennedy, so in health department. And it was really interesting and important to make it happen. And because when you can make it happen in maybe USA, we can make it happen in other countries more easier. So for that, I am really interesting to making growing, and they share that 13 state in USA, maybe more now, are using like ivermectin, like fembendazole, membendazole, and of course vitamin C, vitamin D, zinc. But when we say, example, vitamin C, we mean about vitamin E, and also about NADH. When we say, example, vitamin D, it means magnesium, it means complex B. When we say zinc, it means all cofactor like omega-3, selenium, vitamin C, magnesium. And you know, there is no miracle vitamin. There is no miracle treatment. The real miracle is in human by God, how to make it happen to be healthy again and better than before. Because when you are healthy and you go to the step to be ill, that there is a problem when you are healthy. Example, like heavy metal, like pesticide in your body, electromagnetic effect. Example, pH, acid, low level of bacteria in microbiota, low level of bifidus. Also, emotional low level frequency. Example, to when you are in low frequency, there is all the different like fear, like angry, and all this can make like culpability, can make the person in worst state. And also about the level of each vitamin, of each oligo element, of each amino acid, of each coenzyme. And with all this material, we can have a personalized, holistic, global, multidimensional, integrative therapeutic approach that I share as a new way to go back to use medicine for patient, for citizen, for humanity. And for that, I make all my publication, my protocol free without any restriction. All one can use it, and we are also open to teach it, to do training for that, and
Sure.
all can make be possible in this way. And thank you for your kind invitation.
Absolutely. I love it. And I remember when that article was published because it really it blew up the internet. And I'm sure you see this too, but a huge rise in cancer. My office probably gets 3 or 4 calls a day of patients who are newly diagnosed and often in pretty severe stages. So from symptom onset to being diagnosed, often maybe a month, and they're stage 4 cancer. And so that article came out at the perfect time because people were realizing that not only is cancer on the rise, but the typical Western medicine treatment for cancer is often quite deadly. And so patients get really sick and they want alternatives. And so that really opened up the window to using all these other medications and really trying to get the body back into homeostasis and alignment so it can start fighting these cancer cells off. And so I applaud you and I thank you for that because it's helped people like myself and other providers who are kind of walking down this journey. And you're right, there's no one fit. So everybody is a little bit different. Everybody responds different. I've seen some pretty amazing results with using different supplements and dietary changes. And you're right, stress is a huge component. And of course, believing in God and the magic of prayer is amazing. And ivermectin and mebendazole. So I thank you for that. And I would love, so you're going to be in Kansas, it sounds like, in November. So
Yes.
that's a place to be. Okay, November, the beginning of November. I would love to go and attend. I mean, knowledge is power, right? And the more that we can all talk and show and display what we're doing and the results that we're getting is only going to benefit our patients in the end. So you'll have to let me know a little bit more on that. I'd love to do that. Are you seeing a big rise in cancer where you're located? And then second, what have you seen in using these different protocols? What outcome are you seeing currently?
Yes. First of all, when I received all my patients, I looked them to the eyes, and I took a long time to share with them the knowledge first. For me, the knowledge must be the same that we have to share as doctor to doctor and as doctor to patient, because they need to understand what is the way. Because if the patient is really ready to be healthy and make the decision like it make now, there is a biology of belief who will start in the body of this person. It's you have to know that maybe 7 to 9 months before being ill, maybe there is a trauma, or there is like a sudden shock, like from some situation that the patient is not attending from this way, but also maybe low level of vitamin D, also burnout, example, also parasites, also example, toxicity from heavy metal, from vaccine, from pesticide. And you know that example that glyphosate as pesticide has the same nuclear receptor in cells, the same receptor of vitamin D. For that, all people now had low level of vitamin D. And there is other things that people must know. Every time you share that normal level of vitamin D, it's between 30 to 100 nanogram by milliliter. It's not true. Between 30 to 80 nanogram by milliliter, it's subnormal. And the normal is between 80 to 100 nanogram by milliliter. What it means, 200 to 250 millimole by liter. So to be healthy, there is like cell energy. Example, you need more ATP because cell cancer gets 2 ATP. Normal cell is around 36 ATP. If you use example NADH, you will give 3 ATP for every cell. But if you mix NADH with vitamin C, you will have 11 more time level of ATP. So 11 with 3, it will be 33. With 2 ATP, it will be 35 ATP. And it's near than normal cell. So this cell can be normal cell, but can also be in autolysis situation. So it's like auto destruction or phagocytosis by high level energy. And a lot of people think that cancer cell had a lot of energy, but it's the opposite. The cancer cell are in low energy. So to destroy them, we have to give them energy, like for example, like centrifugation. It's a way to make it broken by herself. And normal cells, when we add example vitamin C and NADH, when we give example the good level of vitamin D, when we make inflammatory situation out, because if you have example dedimer high level and C-reactive protein high level, we have to introduce like coenzyme Q10, we have to introduce vitamin E, but not at the supplement level, but the other level between 800 milligram to 3,200 milligram a day. It's depend of the level. And when we make also anti-inflammatory diet, nutrition diet, like to get out all GMO, like all what is using now. It's not bio. So if we keep it out, and also to keep out example sugar, and also to use ozonotherapy with fruit and vegetable to make pesticide out, and to drink good water. Example, you can use ionized water with pH 9.5, or to make detox with 11.5 pH. You can make yourself healthy again, because you need 3 ways. One, it's detoxification about all heavy metal, pesticide, aluminum is inside the heavy metal, but all the different, and also electromagnetic also, and also to make cancer cell broken by herself. First way, to use vitamin C to pro-oxidant therapeutic doses. And cancer cell will use vitamin C as glucose by the Troy of the horse Troy. Cancer cell thinks that it's glucose, but it's not glucose. So there is a situation it will keep glucose and make out peroxide of hydrogen. And peroxide of hydrogen will block the cancer cell. And when we mix NADH and vitamin C with ATP and peroxide of hydrogen, we will have 11 more results. So we have a quick answer. And also, if we use ivermectin and membendazole or fembendazole, the way that how we stop the parasite by this treatment is the same way that we will stop with it cancer cell. So it's not only parasite is responsible of cancer, but you have to know that if someone has parasitos, there is high level of C-reactive protein, there is high level of eosinophili, there is low level of immunity, low level of in the microbiome, and also if someone have cancer or get chemotherapy or radiotherapy, the level of parasite will be higher. So it's a real problem that we have to resolve. We have to treat parasite as parasite. It's logical, but the way that we make out parasite make out also cancer cell. Why? Because there is glucose and glutamine like energy for cancer cell. And with this way, we will make out this mechanism. We don't say that glucose and glutamine or vitamin C or vitamin B12, if it can make energy in cancer cell, we have not to give it. But we have to give it at the good doses to make the good job, like not nutritional antioxidant doses, but pro-oxidant therapeutic doses. And in this level way, there is a lot of doctors and scientists who don't understand the difference between antioxidant nutritional global prevent doses and between the pro-oxidant therapeutic personalized doses. It's the same molecule, same vitamin or same molecule, but it's not the same doses, so not the same way to use. Example, if someone is in low level of GABA, he needs L-glutamine, but he needs also inositol, and he needs complex B to use glutamine for making level of GABA high and to not give energy to cancer cell if there is any cancer cell. So there is no way to say we have to make out this or this way, but the knowledge is to say how to use different molecule and how to use it as personalized therapeutic integrative approach, because for everyone, different doses can make something different. Example, if you have problem in life, example, next COVID confinement time, example, who had someone of his family passed away, example, or how say divorce or something like this, or problem in work, he will get a low level of tryptophan, and tryptophan gives serotonin, and tryptophan gives melatonin, tryptophan gives also glutathione. So you understand that it's not only something to do. there is a lot of things to do. Example, if you need collagen, you have to keep vitamin C, glycine, lysine, and proline. So amino acids are all important. Vitamin C and vitamin D and zinc, we use it as superstar. But in reference, there is other study that show us that there is no miracle vitamin, no miracle molecule. Body need all one and to make the body healthy. So for that, we have to get, like we say in with neurotransmitter, an acetylcholine view, like artists, like 3D. You have to be healthy. Don't say that I need this, maybe I don't need this. Maybe we need all things, and for that we have to have to eat every time different nutritional and different way to get different vegetable, fruits, meat, eggs, and different things. And we have to say how we can keep it a bio from local regional, like we say terroir, and also of season, because where we live, we need the product of this place. Maybe we can need for our how to say, like someone pregnant hope to eat like some tropical fruits, okay, for one time or two time or three times, but for every day we need to know what is the product of our local state or local territory, because we need what the earth gives us. And when we understand this, example, where I am, there is a less level of selenium in the earth. But you know that the mass product that we have is a high level of selenium, example, truth and other things, yes. And if people of different other place make the price level, the people of this place maybe will not use it as before. So for that, we have to be intelligent. We have to be more simple, because to be simple is the real intelligence, to get how to get the better for us. And I think it's more simple than we imagine. And because it's simple, a lot of people don't think that it can be possible to happen, because we learn how to make it difficult. So we have to learn how to dislearn that we know it before.
Yep. And that is key. That is key. Are you getting pushback? I'm getting a few oncologists that are kind of opening up a little bit to what I'm doing. And I want to learn what you're doing and really implement what you're doing too, because it's amazing the results. But are you getting much pushback, or are you seeing that oncologists in your area who have been trained one way are opening up to something a little bit different?
Yes, I have a methodology for that.
Okay. Yeah.
Yes, because we need to say all will be happen. We have to be in the memory of the future to make our present different, and we have not to get we don't care about how it happened in the past, because when we are in with an aura, with an energy to make all possible, all can be open mind and welcome for that. I say at the beginning that semantic is important. And when I say oncologists must be the leader of hybrid orthomolecular medicine. So I was invited to different anti-cancer center in Algeria, and I do training for oncologists. So we have to change, first of all, as doctors in orthomolecular medicine, also for others like physician, naturopath, or other dietitian or other, they have to be making a welcome coming, like giving a hug if it's necessary, because we need time to make the thinking mind change. And I share also that maybe we need 11 years, but I started for 11 years before, and it happened now. But it's now growing exponential. So I received a message, mails, emails, and exchange from different oncologist doctors. And also, you know that in Algeria, Algeria is independent in 1962 at the time of John Fitzgerald Kennedy. And when it's at the independence, here the healthcare, the health politic is that the citizen is the first responsible of health choice. So no one can give what a patient need. There is not authority from the authority, but the authority is from the citizen. And I think Algeria, with this, maybe for that I was chosen as president of International Society for Orthomolecular Medicine. For that, we make it happen. There will be an university, university, an official training about orthomolecular medicine in this June 2025. I share with all doctors around the world. They say, wow, it's a first time in the world. I say, let's make it happen here in Algeria. And next, it will be happen in different place of the world. Because when we start do it in one place of the world, officially, I don't share about what is doing in private training, but officially at medicine faculty, at pharmacy faculty, at biologist university, it's like a butterfly effect. We can have the same result. If we do it here in June, we can do it around the world in September. So for that, we are making, and we are really happy that it's also can be happen in USA, because now all is changed. And I think that next COVID time, nothing can be like before, because as what say Hugh Riordan in 1976, when you know, and it's never like before. And maybe we are at the new step and the new level of a new history for healthcare, for medicine. And when it's enough, it's enough. And when it's time to do it better, to do it with the heart, with conscientious, with a spiritual view, we can make it happen. And sometimes there is a lot of from this spiritual also, how say, placebo also, of course, because nocebo gives sad effect, placebo gives good effect. And placebo, it's not something, how to say, if you use product without benefit effect. No, the real placebo effect. That is to say to the patient, if you decide now to be healthy, and by the way, who don't take any benefit from your healthy problem in your professional relation, in your familiar relation, in your society relation, all what you have to do is to do it with you. What you need, you do it with your personality, not with your problem health situation. And when the patient understand this, it's like a light, and also you can see in his face that he understand. And because there is sad times, bad times in the life of a person, there is also the good time, the light time, the knowledge time, when you can invite your subconscious, your biology, your health situation to get like a new birthday in your life. So you can had two how say two celebration every year: your birthday official and your birthday of knowledge, and life is simple.
I love it. I love it. This is awesome. I want to we'll circle back in a couple months. So June is when you do that. So I would love to reconnect, and we'll do that in the next couple of months, and you can explain some more. And thank you so much for sharing everything, and keep posting what you're posting, because I'm learning a lot from you, and it's helping me in my journey, helping my patients. So I really, really appreciate it. I know it's late for you at home, so but thank you. I applaud you, and I'm excited to continue to work alongside you.
Thank you very much.
Yes.
I am so glad that we share and to do this interview. So all the best to all patients, to all citizens, to all doctors also, to do a hard professional work. And also doctors need to be healthy, also need to know how to be healthy, how to make patients healthy. So I say all the best to all humanity. And we are now in village. We are now world citizen. We cannot say that what we do is not with effect around the world. So all people can do the best, and life is simple. And thank you very much, Dr. Ilyes Baghli. Thank you
Thank you so much. Thank you so much.
so much. Thank you.